the reason we are here leading this, as Becca said, we are the technical assistance to Brownfield provider. And so our goal is to reach out to communities throughout EPA Region 3 to make sure we are keeping you up to speed on basic information, but also what we call hot topics. And it is basic information when it comes to actually applying for an EPA Brownfield grant, because that is a important part of the section within your application. But it's more of a hot topic because it's probably a little bit different than just a basic how do you apply for a grant approach. So that's why we are here today. And we welcome you. And I'm not quite sure how long it's going to be until Christian comes back. But hopefully everyone had a chance to take the poll. Again, that's really helpful for us. It helps us with our metrics. And yeah, hopefully he'll come back on soon. Oh, here he comes.
Gotta love technology.
Yes, we do.
All right, Christian, can you hear us okay?
Yes.
We can hear you.
I'm a bit hesitant though.
How's the computer working?
Give me a second. Let me just do something a little bit different, pulling the file back up.
Yeah. It's all good.
Thanks. So just a reminder, go ahead and have your browser pulled up if you want to follow along, right, Christian? He's going to guide us through just as we did last month with some websites. So, you know, if you have your dual screens up, go ahead and have one ready. You may have to put the sandwich down while you're navigating that, but that is part of today's session because it is interactive again.
Yes. And of course, if you have any questions throughout the presentation, feel free to put those in the chat. We will be monitoring it and helping Christian to make sure, like, we've got 3 eyes on it to make sure your questions get answered because we want this to be helpful for you.
And the PowerPoint presentation and recording will be made available after the session.
Okay. Do you see slides?
Yes.
Yep.
It may have been a quick recovery. Let's keep our fingers crossed. Okay, we ready to go?
Yes.
All right.
Take it away.
We're done with polls as well.
Okay. Thanks for doing that. Thanks for everybody's patience. It's great to be back here again. This is a picture of me practicing what I preach. So I'm a faculty member in the School of Public Health and Social and Behavioral Sciences. And, you know, my research interests, you know, and personal interests align a great bit with what we'll be talking about today. So I'm very much involved in working on physical activity and how we build our places, our built environment, and as a determinant of our health, and how we build places impacts our physical activity in everyday life. So looking at the policy and built environment, especially in smaller towns and rural areas. So done a bit of work on that. As I'll say multiple times, I'm happy to address any questions specifically about and help you all with local data or local information as we go through this. So there's my email address. That's actually from a bike to school day. So yeah, biking through the woods to get to school with the kiddos. All right, so here's what we will talk about today. I'm going to approach, we're going to talk about, you know, obviously Brownfield's assessment grant activities. I'm going to talk about assessment from the public health world. So 3 things that I'll highlight are what entities have to do what we will call, I'll call a China throughout. Sorry, I hate to use that acronym, but community health needs assessment. So we'll talk about which entities have to do that, a typical process of a health needs assessment. I think you'll see that it overlaps quite a bit with Brownfield's assessment and cleanup and how to get communities involved. And hopefully you'll see that. The other thing we will do is look at, do a little bit of work on your end. That's why having the web available, how to find a local health needs assessment, the priorities in it, how to get involved, maybe how to partner in that. So specific objectives align with what I'll highlight. So understanding a bit of the regulations surrounding community health needs assessments, or just community needs assessments, and the common processes and activities, and how to use a local China to identify existing priority health needs, and or how to undertake one on your own. All right. So as a bit of a review, why, when we talk about brownfields in public health, these community concerns about brownfields center on public health issues, to turn these, what I would call these bad built environments, into health promotive built environments, right? So turning, old rail beds and old abandoned rail lines into rail trails and other assets for the community. And what I will often talk about it from my world is that asphalt, asphalt is a great health intervention, right? So how we use our built environment can be very health promotive. And oftentimes, when I talk about brownfields, and we'll talk about brownfields assessment grants, it's not just about reducing exposures and taking away nasty stuff in the soil and the air and the water, but also how those assets can then be promotive of health behaviors, encourage people to be active, provide new access to healthy foods and healthcare. So those are, in the public health world, we talk about this stuff all the time as these social determinants of health, right? And you probably heard that term, but within that are community assets and built environments and natural environments. So specifically today, we'll be focusing on the brownfields assessment grants and showing how those of us in the public health world, maybe through the Technical Assistance Center, can help you make that link and strengthen your application when you're looking at an assessment grant. So when you look at the assessment grants, and I'll talk about more detail, but one of the activities, the planning activities that you can use it for, is a community health assessment. Okay. And the EPA has a one-pager and other information that will highlight and get, if you haven't seen them, at least either put the links in the chat or send them out afterward. Okay. So again, a little bit of a review, but also an extension from the first part of this series. When looking at the grant application, right, we always go to the rubrics and the scoring, how you'll be scored in your application. So there are two aspects that, thinking about health needs assessments and working with health departments could be beneficial. First one, and I'll talk a little bit more about this as well, but community need and community engagement, right? We'll talk a little bit about health needs and how to engage with communities in that. But also for those that are doing monitoring and other activities, there's a specific requirement to work with the local health agency. But again, I'll reinforce area 2 here and part 1 as much as I will probably talk about new information. Actually, I'll focus mostly on point 2 here. And in this, section 2, community need and community engagement, want to stress why a local health department, so LHD stands for a local health department or a local health agency, why the partnership is beneficial. Health departments, they may serve as an entity that already has, remember in the first part, we looked up health data, right? And trying to find those resources. But a local health department may already have identified, priority health needs and the health disparities and or the wants of, underserved or sensitive populations. That's a specific charge of health departments, and we'll talk more about that. Secondly, local health departments and other local health entities need to conduct these health needs assessments, particularly if they're going for accreditation and additional, if they're going for accreditation specifically, and local hospitals as part of Affordable Care Act and IRS regulations have to do this too. So we'll look at those opportunities where maybe another entity is already working on this. So you could stress in your application how you will involve or be involved with other entities as great partners, or you could use existing data and things that the health department has already done, and seeing an opportunity to add them in as a partner in your application, as something that has already been done that could strengthen as a partner, and community input into your application, and how to prioritize what to do in the area that you're looking to remediate or improve. Okay. All right, so that's a little bit about section 2. So the other thing in the application that you see on the right, that one of the eligible uses is specifically to address public health issues through a community health assessment. And again, the EPA has a great one-pager about this planning program fact sheet that is referenced in the application. So there are a couple things in that document that I want to stress. First, how a community health assessment can help. So if one has already been done, you can just use that to say, and I'll show you an example of it in a bit, to show how your brownfield site assessment and cleanup and reuse can address an already identified community health assessment. Or you can help support a local one that is a community health assessment, or China, that is being performed by another entity. So there are two ways to either get involved as an implementation partner on a previously completed health needs assessment, or to work on an upcoming health needs assessment, or use your funding to be part of one. So there are two ways to get involved. Okay, that was a quick look, and I think there'll be an opportunity, obviously, to interact at the end and talk about your questions through this. I could talk a bit to address specific questions, but let's talk about who has to conduct a community health assessment, and what the typical process looks like, followed by a couple of examples. So one of the major players in this area are nonprofit hospitals. It's a huge industry. It could be a great way to get involved. Now, why they have to do this, actually through the Affordable Care Act, IRS regulations stipulate that nonprofit hospitals have to provide what's called community benefit. There are two big buckets of community benefit. It used to be a lot of charitable care, right? Unreimbursed care to people that just don't have the means to pay for it. In states specifically that increased or expanded Medicaid, a lot of what hospitals write off as charitable care has reduced quite a bit. So they have to show they're really working to provide community benefit to address priority health needs as part of their charitable mission. So you see in this third bullet point, this is a condition of tax exemption. They can actually be fined, in worst case scenario, lose their tax exempt status if they don't conduct a health needs assessment and implementation planning every 3 years. That's pretty heavy-handed, doesn't happen very often, but it is out there. That is one of the regulations. And as I was talking about the social determinants of health earlier, the Affordable Care Act and China requirements really push hospitals to go outside of their walls to address the social determinants of health. Some have even, some hospitals that are really at the forefront of this have, addressed, they get penalized every time someone a repeat customer keeps coming back for the same issue if it's within 30 days. So, those heavy users of emergency departments, oftentimes they see secondary effects of being unhoused. So some hospitals are actually building housing to address homelessness and the unhoused population, and that is a community benefit. So really working upstream, housing first kind of thing. So if we look at community benefit, I talk about nonprofit hospitals as huge players in this. Excuse me. You can see that in a look at by the American Hospital Association, at the community benefit that is provided in the US, you can see this charitable care in the dark blue is about half of over a $100 billion quote unquote industry of providing community benefit by nonprofit hospitals. So those other community benefits, you know, those are things like providing housing, like addressing the built environment to prevent subsequent health issues that Brownfields could really be a great partner in, and addressing Brownfields could be a great opportunity. Okay, so that is a look at nonprofit hospitals. Now, local health departments may have a lot lower budget, working in public health here myself, but essentially public, health departments, local health departments, state health departments, or tribal health departments, if they are seeking accreditation by the Public Health Accreditation Board, they have to work on these 10 essential public health services that are pretty commonly known in the public health world. And what I want to focus on today are these first few in the assessment world, the red and dark orange. In assessing and monitoring population health, so identifying priority health needs, and investigating. The other thing is health monitoring and investigating environmental health issues that really overlap with Brownfield. So I'll really talk about this first one, assessing and monitoring population health. So again, every 5 years, if health departments are seeking accreditation in domain 1, which is assessing and surveillance, assessment and surveillance, they have to do these, they have to show that they can perform these foundational activities, including developing a community health assessment, collecting data, and working with other entities and data sharing and data exchange. So perfect opportunity to collaborate, especially with a local health department. Okay. All right, so those are the two main entities that have to work in this community health needs assessment and improvement planning space. Okay, so some examples. So some of this is from my own work, and there are many different ways that community health assessments or community health needs assessments are conducted. But the typical steps, and I think, sorry, there's like a celebration going on out in the hallway. So if you hear some noise, that's what's happening here. Typical steps, there are 4 typical steps in this, in a health needs assessment. First is to get a team or a leadership team and collaborators together. So that's a great opportunity to work with a nonprofit hospital or a local health department. And what they typically do in this organized step is define the community, geographically or demographically, and they need to identify vulnerable populations. Okay, so again, that fits perfectly with the assessment grant. Okay. Secondly, in this assessment space, they have to either gather existing health data, so secondary data, what exists out there, and I, looked at that last time, and or they need to go out and get information from and health data from their existing from their community that they defined in that first step. They typically will work with that health data, analyze it, summarize it, and get some community input to help move to the next phase, which is prioritize what health needs are really important to the community. And sometimes in this assessment phase, you'll see like a community resources or asset mapping event where key partners, such as nonprofits or other entities working on brownfields, can come in and say, here's what we are doing in a way that we could help you. So in the prioritization phase, I already have some asset mapping and other community resources identified, and they need to come up with a small number of priority health needs to address, because and then there are some documentation and reporting things that we'll look at. Hospitals have to publicize this in writing and on their website. And local health departments typically will do the same thing. And so, you know, a hospital board or someone will vote to adopt priorities and then help to move to the next phase, which is the last one on the slide, which is implementation. They have to get people together and say, all right, these are our 3 or 5 health issues. What can we do about them, right? And hospitals specifically have to show an evaluation every year of what they are doing to address those priority health needs, and how they are spending money on it. And that comes through a 990 and tax forms. So the key is that these documents will be online, the documentation, and they have to disseminate them. Okay. So that's a quick snapshot. We spend semesters figuring this stuff out and the steps to take and different ways to do it. Many different ways to do it, but these are the typical phases. Okay, so now we have plenty of time. This is good. Okay, so a couple of examples. This first one, so some colleagues here in the School of Public Health and I have been, we're involved with WVU Medicine and all the different hospitals over the years, over about a 4 or 5 year period. I've since moved out of it, but others continue to work on this. And so what I recommend, having done this before, is for those of you out there in the audience, typically the best way to do this is to search online for your local hospital name, local, so if we're looking for a hospital example, and community health needs assessment or community health assessment. You can see here WVU Medicine. They have all of theirs online. This is just a snip from their main page. So we'll look at, you can see for the specific hospital in Morgantown, Ruby Memorial, they have every health needs assessment. You can see every 3 years, typically they do one, and each implementation plan. Okay, so excuse me, that's a quick recommendation on a search. Then once you get into the document, a couple of quick recommendations. Just review the table of contents to look at some of the methodology, who was involved, right? To see if some partners could be involved, and see if they have data that you can work with. So here, when we wrote this, we talk about secondary data and primary data. And again, secondary data is what exists, some of those existing data sets. Primary data is what the entity that did this report did to go out and get community input and get new information. Typically, what you will see in one of these reports is, a whole bunch of information, right? You want to skip that and typically go to an executive summary or a priority list. I think you can see that. Yes, the conclusion and an executive summary typically to get the priority health needs. So you can see in this one for the local hospital, you want to look for the specific priority topics. So in this case, there were 3 that are highlighted, and see what logical links there are to brownfields. And you can see, I could very easily make a logical link that through addressing a brownfield, we could address obesity and chronic disease, right? By encouraging healthy physical activity, encouraging, better access to fruits and vegetables, let's say, or healthcare access. I know there are examples of that, Brownfields activities in Florida on that. But specifically in cancer, right? That's even in the Brownfields assessment grant application. So there are some obvious links where Brownfields could be involved and be a great partner in implementing something to address these priority health needs. Okay. Here's an example from a local health department, from the Cabell Huntington Health Department, which is one of, I believe, 2 accredited health departments in West Virginia. So for this one, the suggested search online for community health assessment and the local, you could just use your county name and health department. So in this case, I looked up Cabell County Health Department needs assessment or health assessment. And you can see the last one that's posted online is 2015. So that I could find. Okay. So once you dig into that one, you can look for, again, table of contents, see what kind of data they used. And in this one, you can see they have secondary data, but they don't talk about primary data or survey data or something they went out and collected from the community. So they relied on existing data from national data sets, probably at the county level. They do have information about community input, community assets. I can see those, down here. Okay, and a prioritization process. Now, I actually looked in the document, and they didn't have specific information in it, but instead they referred the user to. Let me get rid of the laser pointer here. Okay, they actually referred people out to an implementation plan. Okay, so again, you want to look at that to see where you could get involved. There are some definite opportunities. And one thing I highlighted and one thing I noted when referring them out to the health improvement plan, they talked about physical activity and the built environment. And this is a snip from their Healthy Vision 2020 priority issues and implementation plan. Actually, the reason why there might be, during COVID, there was some leniency on the 5-year requirement on health departments and 3 years on hospitals. So I think that might be why we don't see a more recent one from the health department there. You can see, again, physical activity. I think there are some obvious logical links to how a brownfield remediation project could address these things. Okay, so those are two examples, from West Virginia. I think I went fairly quickly on that. So before we get into a quiz, are there any what questions do y'all have about maybe the search and what to do? Because I'm going to ask you to do a search. I don't know, Becca, do you see any specific questions out there in the chat?
Nothing yet.
What is everybody having for lunch? That's the important thing. No. Okay. So before we get to that, there might be some chatter on that. So let me get that out of the way. So before, maybe what we can do is go ahead and get right into the quiz. Okay, so just like last time, had you go out and find some local information. So for everybody out there, your mission, if you choose to accept it, is to go look just online, look up your local health department and or your nearest nonprofit hospital. It could be a regional health system like WVU with a local, multiple hospitals. But see if you can find one, either a local health department or your nearest nonprofit hospital, and either look up health assessment, health needs assessment, and see if you can find one. Okay. So when you're doing that, enter in the chat which, the name of the health department or hospital that you found, and dig into the table of contents and the document itself to see if you can find, the priority health needs. So yeah, enter one health priority in the, well, that should be in the chat. Should say enter one health priority in the chat rather than the China or needs assessment. Okay. So I'll give you a few minutes to do that. So again, find a local health needs assessment and tell us which one you found and maybe one of the health priorities. Maybe we could talk about it and how you could either get involved or address one of those health needs. I'm going to be quiet while that goes on. And Anne, I see your question there. I'll talk about that in a little bit. All right, Becca has Uniontown, Pennsylvania. All right. And obesity is one of the priority needs. Okay, good. Thank you, Becca. Okay, Anne has a Virginia Hospital Center. Very good. Depression, mental health, and obesity for sure. So for those that found a health need, addressing obesity, depression, mental health, Anne and Becca, maybe see if you can find an implementation, see if they reference an implementation plan or ways to address it or assets that might be used to address it. Raquel, hopefully I'm saying that correctly, Durham, North Carolina, and affordable housing. Bingo, well done. So I'm going to stop sharing for a second, see if my computer blows. Well, maybe I won't, just in case the computer blows up again. All right, other folks out there, are things going okay? Or do you have questions or struggles? Looking over here. How about this? Anybody not finding one want to speak up and say what's going on? We got a few others. Good. Huntington. Yeah, thanks, Derek. Huntington and opioids. That's going to come up a lot. That'd be interesting to see the logical link of a brownfield to addressing that. Maybe used for a treatment center or something, a remediation or a healthcare access. That might be interesting. Yeah, Katie, thanks. Grant Memorial. Chronic disease, obesity, substance use, mental health, cancer again. Yeah. Very good. Yeah, thanks, Ann. 2 treatment centers on former brownfield sites. Very good. Drug and alcohol use in Wetzel County. Thank you, Zane. Yeah, very good. Yeah, a lot of, thanks for posting all that, Derek. So cost of healthcare, yeah. Awesome. Yeah, so Anna asked a good question that I'll talk about quickly here. Anne was interested in hearing how, excuse me, how the work connecting brownfields to community health needs assessments works with hospital and health advocates. So that's a really good question, Anne. That can be a tough one because I think in the hospital world, they're typically focused on care. And so pushing some folks in the hospital up to a public health or population health approach, getting them to think, 3 steps ahead of the eventual condition or issue can be difficult. So when we mentioned that example of, I think it was the Mayo Clinic actually was working on housing to address the unhoused population and thus mental health, substance abuse, oral health issues, and all kinds of things that cause, heavy use of the emergency departments. when we mention that in some, leadership team meetings, they look at us like we have three heads. So, I think as this population health approach to in hospital, executive suites and others becomes more popular. And I know we are educating more people that work in hospitals in population health. I believe this social determinants of health and working upstream is becoming more acceptable. So you don't see the immediate impact of a surgery, let's say, but you see the eventual impact of improving housing or improving food access and things like that. Does that help, Ann? Feel free to speak, everyone. I miss y'all. I miss voices. Yeah, Raquel, let's see.
You're doing well, Christian.
Yeah, it's hard. I got no feedback here. I don't miss teaching on Zoom, that's for sure. But it's great to have people from all over the place. So Raquel, do you want to talk about what you put in the chat? And forgive me.
Sure. I was thinking about this issue of not thinking about healthcare as the one all, be all, but thinking about population health and how community health needs assessments need to be probably gathering more data on the social determinants. I used one example here because it's one I'm very familiar with, but of course, others could also be considered. This one is near and dear to me because at some point I was developing a survey instrument. In this case, we were looking at a national survey, but of course, the instrument could be used in a more local way. And we had basically two issues that really could only be assessed via survey because what I mentioned there, perception. So yeah, you can measure a lot of things by just looking at a map, but there's a difference between what the map shows and what people actually have. And the other thing was this issue of frequency and types of use, barriers, because again, if the hospital is going to be involved in any way in a health promotion activity, or if when we are preparing the Brownfields revitalization plan, we are incorporating these social determinants, it's important to have the needs assessed at the community level. We can have some large scale ideas. We can look at maps to get, area level data, but we need this perception and individual level data to also be included, I think. But I wanted to hear what you think about this.
No, it's a great point. So as you'll, excuse me, some of the, and I know, Ann, please feel free to put Brownfields to Healthfield stuff in there. But in the health, in the China process that we used with the hospitals and a lot of other entities, I believe, are using it, it's getting the community input in addition to using some of the access to nature, access to healthy foods, and access to places for physical activity measures that are done at the county level. And just say, and part of the prioritization is somewhat from the leadership team at the hospital and key partners, that have authority over changing things, but also from the people that are recipients or beneficiaries of the change, and going out to communities that are historically just not served. And so blending those two together is kind of an interesting process. Say, all right, hospitals, here's what the community and the people we talked with are telling you through a survey or through focus groups, right? And going, we've gone out to, for example, we've gone out to the western part of Monongalia County, which is very different than the area in Morgantown, the county seat of Mon County here, which is dominated by the university and white collar businesses. But if you go to the western end of the county, you'll see much more federally qualified health centers, a lot of people on Medicaid, a lot of older adults, and people that are traditionally not served. And they told us something very different than what people from, the center of the county, were telling us. So, yeah, the idea that a map shows you everything is not necessarily, it won't get you the full picture of the story, the full story. Yeah,
And
so great point. Yeah.
Yeah, but Anne does raise an important point as well, which is given that surveys cannot be eligible for these grants, then being more targeted towards what can
Yeah.
is possibly the way to go. But then other sources could complement and get those data. And then when we're again looking at the revitalization plans, we can look at multiple sources. So
great point. Yeah, that's where the reports, they might be long, of the health needs assessments and implementation plans, but you might find some nuggets in there where they've already gone and reached out to communities, and then you just become a partner in getting into the implementation process and possibly receive funding from a hospital that has to show community benefit and how they're changing things.
Thank you.
Yeah, thank you so much. Great comments. Okay, so I think we can start to wrap up. But I want to make sure there's time for folks to, Anne's putting a lot of good stuff in the chat. We've talked a good bit about brownfields to health fields and working on that, understanding the benefits beyond, exposures to also health promotive activities. So lots of great stuff that's being captured in the chat. So if other folks want to speak up, any concerns about, any issues finding these things, hopefully I've just given you a little bit of our language in the public health world if you don't usually talk with us. And hopefully you see the overlap. So it just might be a different language. So just a quick summary slide. I'm always happy to talk more, but these health needs assessments, community health needs assessments, just to summarize, they may exist from the nonprofit hospital or the health department, so you can figure out just how to get involved, maybe access, be a good partner with the hospital to just get involved and address something that they're already working on, and they may want to show good partnerships and spending money in the community as community benefit to changing things. Talk about if you're applying for an assessment grant and you are conducting, working on conducting a health assessment, the health department or hospital would be a great partner in that process. Or you could go see if it's part of their cycle now where they're working on, they should be posting about conducting a health needs assessment. You could get asked, figure out who the leadership team is and get involved. And again, a lot of information is online. Great helpful resource from the EPA exists. So yeah, hopefully you learned something today. Becca, I think I'll turn it back over to you to launch a poll or talk about upcoming events before we close.
Yeah, so I'm going to go ahead and launch this post-webinar poll for everyone. And we really appreciate your feedback on these Zoom polls and input. So that just helps us meet our grant requirements. So just seeing what you learned, what you got out of it, that should pop up on your Zoom. And then while you are taking that poll, let's see, we've got a couple of events coming up. So our next webinar here with TAB will be on May 3rd at noon. We've got a registration link available as well that I can drop in the chat after I find it. And there are also some state conferences coming up. So when we send out, here's that registration link. State and the national conference, of course, thank you, Anne, that are coming up kind of over the summer, early fall. So Virginia, June 13th through the 15th, in Danville, registration is open. The West Virginia Brownfields conference is in September, and that registration will open later this summer.
Yeah, and I think Anne had her hand up, but then got booted out. Ran away and then came back. Are
That
you still
seems
out there, Anne?
appropriate. Thank you for this. I was wondering if you were actually going to talk about this more at the West Virginia Brownfields Conference, or, you know, at the National Brownfields Conference, or are there other places that we can help you spread the word on this?
I'd be happy to. I know I did not get a proposal in time to get, together in time, but I'd love to talk more about it, because I think it is a great opportunity to merge the public health and built environment folks with folks working, especially in smaller towns and rural areas, and or in traditionally, communities that are suffering from disinvestment, basically, no longer, private investment improving areas, and say, here are great public partners that, have to do these things and show benefit to their community. So I think it's a great space to get different, EPA, public health department people together. I think I see it happening, but I'd be happy to help be a part of those conversations, Anne.
That would be great. I mean, I'm curious for others who are on this webinar, like, would it help you to have a few concrete examples that might help your community make that connection to the healthcare institutions? They might not get brownfields, you do. You're trying to bridge that connection. Would some, model language or something be helpful? And not to take over your webinar, Becca, sorry.
No, please do.
And I think you
That's
raised,
my job.
you raise a good point. I know that's something that's a large reason why we wanted Christiaan to join us and present this information, because he thinks we're just joking, but I said, seriously, Christiaan, we speak the Brownfield application grant language, and Christiaan is the expert in public health. And so by bringing him in on this, he helps us understand how his piece can fit into the bigger picture in terms of the application. But there is, in fact, so much more that we can do and should be doing to help communities understand. That's also part of why, Anne, we wanted to hold this webinar at the time of year that we are, so that folks can have it on their radar and be thinking about so their gears can be turning when those guidelines are released in the fall. So we're happy to coordinate with you too, to see how we can reach out to folks.
That'd be great. And I mean, I'm thinking the other thing, I absolutely, whatever it is that the communities need, it doesn't need to be for your next application. This is something you can incorporate in your existing documentation and work. And also, really, if there's ways that we can help you make those connections, not only the built environment. I mean, Christiaan's obviously an expert in the green space and the recreational and physical activity part and the active transportation, but there's other connections, like he said, food or affordable housing. Obviously, sustainability and resilience are hugely important, but open to hearing from you what would be helpful.
And before we move on from this point, I appreciate that. And one of the best things y'all could do, and I don't see everybody's face, but provide pretty pointed feedback today, because this could be, I know this could be improved and get the language from both entities in better, and could be, we could spin it a little differently based on your feedback of, how does this meet your needs, and how we could improve this for a larger audience, maybe at a state or national meeting, because EPA has good resources. So I think that would be helpful. I'm an evaluator, so please evaluate me. All right. All feedback is friendly. That's someone that served in Vietnam told me. He said the bullets whizzing by my head was good feedback. So anyway, he's also a gold medal winner in rifle. So anyway.
If I could also add a point, I didn't want to sound too disparaging of the mapping tools, of course, which I also find extremely useful. I was just really trying to make the point about some data not being only the objective data that is needed. But to Anne's point about how do things connect with the brownfields, I feel like this connection with the social determinants is really one that is often missed, or at least just gleaned upon and not really explored. And so for me, it seems like that might be where a lot of help could come. So to make the healthcare system understand the importance of health promotion and prevention of disease, rather than just look at the environment from the negative perspective of all bad that comes out of it, which of course, people who live in brownfield communities know that it is bad, but there's also good stuff, and there's stuff that we can promote to be better, right?
Yeah. Yeah, thanks for that.
Absolutely.
And I'm just going to show the last piece. One thing that I'm reading a bit about now is community allostatic load, like community stress levels, and, you know, broken window theory, other different social and sociological and other theories definitely lend a hand to improving the built environment as a social determinant of health. So yeah, very good. And I just want to make sure we have our contact information up there. I know folks are starting to drop off probably for 1 o'clock meetings, and I have to zip to one as well. So Katie?
Christian, you've done a great job. Thank you so much. Yeah, as Christian said, if anyone has any questions, please don't hesitate to reach out. Christian is very helpful and friendly. He'd be happy to talk through any ideas that you may have, and we'd love to help you in any capacity. As Anne says, it's not just about the EPA brownfield grants, it's anything, because they are our communities too, and we want to make them better for everyone. So thank you so much for joining us.
Thank you all for your time and attention.
Thanks, Christian. You did a great job.
Go enjoy the sunshine.